Hi, in this video, I want to share with you about the proper procedure for medication wastage. So, first of all, LOA medication. I mean like leave of absent medication. So one person going out and the staff use repair medication for that person is they call LOA medication. And when they come back, any single tablet returned from an LOA, that means that medication have not administered during that time. So now it's come back, right? Any single tablet returned from an LOA will dispose of in a biohazard container, and you have to make the incident report. Okay, so next, disposal of a tablet that's a whole with non-controlled medication that has been brought prior to administration shall be placed in the locked medication wastage box, and the medication wastage form will be complete and placed also beside together with the rocks. And if during administration a tablet drop on the floor, okay, so the medication will obtain from the last dose on the backmat roll, and you have to contact the pharmacy as soon as possible to order the replacement dose. And after that you have to call the supervisor or calling supervisor and the staff administering medication on the last day of the month. Actually, some place the drugs will be supplied by pharmacy by 1 week or 2 weeks. So in here, the staff administering medication on the last day of the backmat roll have to finding the spot empty and will use the extra dose supplied by the pharmacy. With any control medication that's a waste prior to administration will be kept aside in the medication cup and placed in a locked container until the control rock counts is done, and the wastage control medication will verify by the second staff and dispose of in the biohazard container. The control rock administration and count record will be needs to be complete. Okay, so when the biohazard container is full, you have to contact the pharmacy for picking up. With the being raw medication, you don't need to make the incident report. Next, and disposal of medication that's not whole. What I mean is medication has been spit out or refused by a person and has been mixed with food will be disposed of. You need to complete the medication wastage form and locate it in the box, medication wastage box. If one person spit it out, you have to make a report. If one person refused to use, you don't need to make an incident report. But spit out or refill, you have to not in the matches. Okay, so next, with disposal of liquid medication that spill or that bottle is breaks will be wrapped up, and you have to use the dustpan or brush to dispose of material with the broken glass. These items have to be placed into an appropriate label container like broken glass. So that a hazard plastic container or coffee can, and the container will seal with the tap when it's full and then put into the regular garbage order. Okay, I want to remind you that with the missed dose or refused dose of medication, you have to document it in the mark sheet, and that person has record in the resident group home setting. You have to write that in the casebook, in the logbook. Yes, and finally with discontinue or expire medication. Okay, with non-controlled medication that's discontinued or has expired, shall be placed in the locked medication wastage box located in the medication area I told you, right? So medication wastage form also will be completed and placed together with the medication. And if that medication is a controlled drug, it shall be placed in the section marked like discontinue or expire control drug, and it will be added to the control drug administration and count record here, and will continue to be counted until the pharmacy come for picking up. Thank you.